Coronary Artery Disease, or CAD, is one of the leading health challenges worldwide. This condition is estimated to impact billions globally and remain a significant burden on the healthcare system. At Evergrowth, we see this condition as something that will prevail in the upcoming years, especially with the current trend in lifestyle, poor diet, lack of exercise, smoking, and stress. These all contribute to the buildup of plaque in the arteries, narrowing them and impeding blood flow. Fortunately, with groundbreaking advancement in the diagnosis and treatment, we're seeing a revolution in how we tackle CAD. Just like other innovators and investors, Evergrowth is interested in our future with AI-powered diagnostics as well as precision medicine tailored to your genetic profile.
I'm Christina Bear. Welcome to today's Business Minute.
Emerging biotech hedge fund Evergrowth Biohealthcare Capital. We invest mainly in young growth biotech company that have their lead drug in the preclinical stage or early product stage because they have much more growth potential. There are new gene therapy being approved, gene editing drug, and then also innovative drugs to treat obesity, to treat diabetes, to treat liver condition, and also many novel or new drugs to treat cancer. Now, by investing in companies that are at the forefront of such innovation, we support the cause that will continue to deliver the hope and new drug and new technology that ultimately improve the quality of life for the patient.
In our binary event forecasting strategy, we have a very high success rate, over 80% success rate. And by using that, we get able to position out properly and take advantage of those opportunities.
Within 6 months, we have over 40% return. So in the coming year, there's a chance of even grow up to multiple year-fold in a very short time.
Welcome to this week Open Mic webinar. Today we have the honor of getting presentation from Dr. Van Nguyen, who's a cardiologist, also medical director of Biotech Medical Group. They're one of the largest hospital group down in Florida. Dr. Van will discuss the topic of today, which is coronary artery disease or CAD. Here I'm going to share with you an overview or summary of what Dr. Van discussed or share with our leadership team. Dr. Van started out by defining this condition. For definition for coronary artery disease, as Dr. Van defined, it's an ischemic heart disease in which it is a condition in which the coronary artery become narrow or obstructed, and this is most commonly due to the process of plaque buildup in the heart, in the artery of the heart or coronary artery. It is called atherosclerosis. That's the process that caused this. Dr. Van then discussed about the different stages of CAD. Now the stages depending on the degree of obstruction in the coronary artery, which is the artery or the blood vessel that feeds the heart itself.
As you see here, we have different stages of atherosclerosis buildup. You have stage 1 with minimal fatty streak, and then you have mild obstruction, and then you have severe obstruction result in decreased blood flow to the coronary vessel. And you see initially we have fatty deposit, and then result in fatty plaque or result in streak, and then eventually obstruction of the coronary artery.
In terms of prevalence, as Dr. Van shared with us, for patients who are 20 years or older, 1 in 20 patients will have a CAD in the USA. Now, that makes this condition the most prevalent heart disease in the United States. When you look at this prevalence on an annual basis, there are roughly 400,000 people die from CAD in the USA. And on a global scale, worldwide, 9 million patients die a day due to coronary artery disease. Shifting gears, Dr. Van discussed about the different risk factors, which include patients who are suffering from diabetes mellitus, genetic also play a role, high blood pressure, as well as obesity. Other contributing factors like a sedentary lifestyle would affect many patients or many people in the USA. We live in a modernized world where we sit on our desk a lot due to our office work. That sedentary lifestyle also contributes to CAD. In terms of the effect of CAD on the body, this decreases the blood flow to the heart, hence it will reduce the oxygen supply coming to the heart, and as a result the tissue of the heart in the affected area will die off, and in that situation there will be symptoms manifested. So the symptoms, as Dr. Van shared, it include angina or chest pain, a shortness of breath, fatigue, palpitation or rapid heartbeat, dizziness, sweating, as well as nausea and vomiting. And then Dr. Van discussed the different clinical consequences, which include stable angina, unstable unstable angina, myocardial infarction or heart attack, as well as silent ischemia. Ischemia is the medical term which suggests that there's a reduction of blood flow to the heart. So when this condition is occurring, it will manifest. The vital sign manifestation include an increase in blood pressure, an increase in heart rate. Also, the patient can have cardiac murmur on physical exam.
As you see here in this cartoon, we have patient with angina symptom, but as you remember, Norman Rockwell, a famous painting of an elderly gentleman shoveling snow and then grabbing his chest, and usually occur in the winter area because of the cold exposure as well.
For diagnosing CAD is typically diagnosed with physical and history and physical examination, but we also order tests that include the ECG, stress test, echocardiogram, CT, MRI of the heart. Now the definitive diagnosis for us to know for sure that this condition is CAD is to do an angiogram where we will visualize the coronary artery or the blood vessel itself. For treatment, typically with treatment include, as Dr. Ben will share with you, it's therapeutic lifestyle changes or TLC, as well as intervention.
The treatment we recommend for our patient including therapeutic lifestyle changes, medications, and mechanical interventions that you can see here. Prognosis really depends on early detection and patient being compliant to medical therapy and lifestyle changes. We recommend to all our patients to improve the quality of life with, to provide more effective management and preventive care.
For new medical trend, as Dr. Ben will share with you, this includes the precision medicine. In other words, we tailor the treatment specific to your genetic profile. And this is important because the same drug or the same treatment will not work for different patients. That's because patients have different level of enzyme in the body, and also the activity level of the enzyme also different. Hence, it's very important to make sure that we tailor the treatment specific to your genetic profile so that you can enjoy the best treatment outcome with minimal toxicity.
In the future, we also use AI in diagnosis and also for early detection along with early treatment as well.
Particularly, as Dr. Van shared, is the use of cardiac troponin, or these proteins that are being released from the heart in the event of myocardial infarction or heart attacks. We then discuss about the novel treatment for this condition. PCSK9 inhibitor is one of the new drug to treat this condition. We discuss how it was developed by Amgen, and then the situation with Regeneron taking the medicine, then develop their own version of it. We also discuss other novel medication like SGLT2 inhibitors, sodium glucose transporter 2 inhibitor, also instrumental in treating this disease as well. If you want to capture this lucrative opportunity while investing in innovation that deliver hope to the patient, but you either don't have time or you don't have the expertise, reach out to us, contact us, we'll schedule a call to see if we are the right fit for each other.